We're good to go. Thank you. Well, today, Queensland can report 2 new cases of COVID, both overseas acquired and detected in hotel quarantine. This brings Queensland to 11 active cases and a total of 1,248 cases since this commenced at the start of the year. 78 cases have been overseas acquired since the 5th of October. So what we do know is we are seeing a surge overseas of positive cases, and we are seeing an increase of positive cases from those who are coming from overseas into Queensland. And that is why it is very important that our hotel quarantine continues to be strong, that we have strong measures in place, and I want to thank all of those staff who are supporting us, their health workers, the Queensland Police Service, who are working with us on our hotel quarantine to ensure that we do contain this virus. We can also report that there are viral fragments detected in treatment plants located in 5 Greater Brisbane locations: Victoria Point, Oxley Creek, Goodna, Fairfield and Redcliffe, as well as Cairns North and Nambour. It is unknown if the positive results are as a consequence of new cases, cases that are still developing, or of course old cases where individuals are still shedding. Given the positive results from New South Wales, it is important that people continue to go get tested if they are experiencing any symptoms at all. We can report also today that it has been identified one overseas individual who arrived in Queensland on the 22nd of December has tested positive for the new South African variant. This will be the first positive case of the South African variant in Australia. We have seen other jurisdictions record a UK variant, but this is the first time the South African one has been identified in Australia. The positive news, the good news about this individual is that they were in hotel quarantine at the time they were tested, and they have since been transferred to a hospital, and we are absolutely confident that all proper measures were taken at the hotel and in the transfer, and of course at the hospital, in relation to this positive case. But what this positive case reaffirms is that it is really important that we maintain our strong hotel quarantine position. Anyone coming from overseas should expect that they will have to spend their 14 days in hotel quarantine or in hospital, that very few exemptions will be granted, because we are seeing an increased risk based on the positive cases overseas and the number of positive cases we are now getting returned to Australia, and of course this new variant. So we do ask that people who are travelling from overseas understand that those are the requirements. Of course they can make application, but they should expect that they would be spending the 14 days in quarantine. I'll now hand over to Dr. Young to make any additional comments in relation to those cases.
So 2 new cases detected in 2 individuals in hotel quarantine acquired overseas, and they've both been transferred to hospitals. And then you heard about this case from South Africa, a woman who arrived here in Queensland on the 22nd of December, was immediately placed into hotel quarantine and tested, and genome sequencing has come back to show that she has this new variant that has been picked up in South Africa that is thought to be more contagious. So we've just gone back and double-checked that in the hotel, in the transfer and ambulance, and now in the hospital she's in the Sunshine Coast University Hospital, that there have been no concerns, and we haven't found any concerns there. But it does reinforce the need that anyone coming from overseas does need to quarantine for 14 days in either a quarantine hotel, or if they're unable to, for whatever reason, due to health reasons for instance, if they can't remain in that hotel quarantine, they need to go into hospital. All our positive cases are being transferred into hospitals so we can make our hotels as safe as we possibly can. Thank you.
Do people flying to Australia from the UK undergo mandatory testing before they fly? Victorian government says they should.
I think it's a useful strategy, but we need to remember that that's only a point-in-time test. So they still have to be tested when they arrive here, and they still need to be in hotel quarantine. It's then up to the airlines what they do, whether or not they will stop those people going on the planes. And we know that people can become positive at any point within that 14 days of exposure. So it's a strategy, but it won't take away the need for anyone who's coming from overseas to still be required to quarantine for 14 days. Yes. It's not considered to result in more severe disease, but we're still working through that now because it's quite a recent finding.
Obviously, it's going through motions of deciding when formal tests will be played. What sort of discussions have you had with Cricket Australia about the possibility that they will be able to play at Gabba if they do play the third test in Sydney on January 7th?
Right, so we have had a number of discussions with Cricket Australia, and they would need to follow the same arrangements that we've had in place for other sporting codes when they travel from a hotspot, which means that they go into a quarantine hotel and the only reason they leave is for training or to play the match.
So they would be able to have the players and the boarding staff go into the quarantine hub after playing the SCG on January 7th and then play at Gabba on January 15th, no tournaments.
That's true, yes.
And have they had a discussion with them about whether they will be going to Sydney or whether they'll just be staying in Melbourne for that third test?
No, those are decisions that they need to make. I've just made clear what would need to occur if they were to play in Sydney, and Sydney was still regarded a hotspot at that time, because that's not even certain, of course. If Sydney were still a hotspot when they played in Sydney, what they would need to do if they then wanted to come into Queensland and play in Queensland.
So has anything changed? They're advised security bodies they can cross the borders?
Yep. They can cross the border, but they will still need to go into hotel quarantine when they arrive into Queensland if they've been in a declared hotspot prior to that arrival.
Dr. Young, back on the international arrivals, we've spoken about how important it is to do that 2 weeks hotel quarantine or possible quarantine. We did have a woman yesterday that you may have heard about, a woman who's been denied an exemption. She was terminally ill. She's saying, there is legislation that allows compassionate and medical grounds, and that's being ignored. In instances like that, is this going to be reviewed? There has been people in the past who have had those exemptions. So what about those people?
Right, the risk, unfortunately, over the last few months has escalated. We are seeing more and more positive cases in the people who return from overseas, and now that we have these 2 variants that are quite concerning developing in the UK, and that variant has already spread to other parts of the world, and this South African variant, it increases the risk even more. So therefore, the exemptions that will be given will be even fewer than before.
In this particular woman's case, I know you don't speak on those cases, she's come out and said that she's had specialist advice being ignored. Is that the case?
My specialist advice is that we are seeing increased cases of COVID-19 across the world. We are seeing increased cases in the people returning to Queensland and to Australia from overseas. And we are seeing 2 new variants that I find very concerning. So my specialist advice is that we cannot allow people to quarantine elsewhere other than hotel quarantine or in a hospital. It is too much of a risk for the Queensland community.
There's a 66-year-old Noosa man who says he's considering suing the Queensland government because he was forced to spend his day in quarantine away from family after returning from New South Wales. He was returning from work and his board pass expired the next day. The restrictions had ramped up after the New South Wales cluster, and he's been in quarantine ever since. What is your take on the situation? I mean, is being treated unfairly?
I'm actually very grateful to the many thousands of people who have voluntarily managed that 14-day quarantine and done very well. We've had a few people who come forward and ask for exemptions for various reasons, which we go through in great detail, and very few exemptions are given because the role here is that our hotel quarantine is there to protect the 5 million Queenslanders who live out there who we don't want to get COVID-19. So I'm very grateful to all of those people who have gone into quarantine. Of course, here in Queensland, given that we don't believe we have community spread in our community currently, we can allow gatherings to continue, which they've not been able to allow in New South Wales. So people do need to adhere to those guidelines. So that's 50 people in your home, 100 people in public spaces. If that's a private gathering, you can have 100 people outside in a public space. Then if you have plans or checklists, you can have more people. So people need to adhere to all of those guidelines, and it is critical that people provide their contact details so that if we were to have a case in any gathering, we'd be able to rapidly contact the other people in that gathering. And indeed, if you're going to a hospitality venue, that needs to be done electronically, either through using a QR code, or the person needs to speak to the venue staff and ask them to put in place their details in an electronic form so it can be captured. So we believe with all of those processes that will make it a much safer New Year's Eve. Now, in terms of, we all like to, on New Year's Eve, give the closest person a kiss or a cuddle. I would suggest you limit that to your known close friends and family, and don't randomly kiss and cuddle strangers that might be there at New Year's Eve. Make sure you know who you're interacting with. So again, if we need to, that we can contact people who've had any close contact.
And the January 8th date for the board, how's that looking?
We'll review on January the 8th as to what happens going forward.
There's a chance that Australia could see a COVID vaccine to Europe around March. Is that something that you welcome? Is that news you welcome?
Oh, of course I do. It'll be fantastic when we get one or many of those vaccines that are now have been developed and have started to be used overseas. And I'm very confident that the Therapeutic Goods Agency here in Australia will go through them very thoroughly to make sure that any vaccine that's delivered here in Australia will be safe. It would be excellent when we can start rolling out the vaccine here to all Australians who are able to have it.
If there was a chance that somebody was pretending that they had the vaccine done, if we did get the vaccine in Australia and somebody was lying about the fact that they had that done or was forging certificates in any kind of way, is that something that would be concerning for you as a health professional?
We always have those sorts of issues and we manage them. So you've got to remember, we have a very strong vaccination program here in Australia, and there are a lot of things very dependent on it, and it's why we have so few of those childhood transmissible diseases here in Australia. So we've got processes, we'll use similar processes for this vaccine.
There are some internationally that handing out templates of what their ID cards will look like once you've been vaccinated, and there's concerns that it could be replicated or fraudulently copied. Is that something that would be concerning for Australians as well, to not be able to travel freely while other people saying that they likely can do so?
Right, at this stage, anyone coming in from overseas, whether or not they've been vaccinated, is still required to go into 14 days hotel quarantine. So no, if there are fraudulent certificates, if I call them that, going on outside Australia and the rest of the world, it doesn't concern me, because we will, at this point in time, until Australians can be vaccinated, we will still be quarantining people in hotel quarantine.
Sydney is going ahead with their virus. We've seen a lot of councils in South East cancel theirs. Do you think that was the right decision for them, or would it be safe in Queensland to gather to watch fireworks?
I think it is best that we still don't have large groups gathering, so I think that the local councils here in Queensland have made very sensible decisions.
Just back on the border, are there any unlikely cases at home in New South Wales?
There are a number, yes, that they're still looking into.
Oh, sorry. Do you know, you might not be able to answer this. Do you know what exactly police are investigating still with the studio?
No.
Thank you.
Thank you.
Thanks.